pop up on your screen that says we are recording this. So you just simply hit OK or continue. So good afternoon and welcome. This is the last in the three-part series that we did called Substance Abuse and Youth. I'm Laura Maloof Miller, Program Manager in the Wellness Department here at HealthNet. Kristen Kayla, Health Promotion Consultant with HealthNet, is also on the line, and the two of us will be monitoring the chat today. Just so that you know, everybody has been muted upon entry, and of course, that's to avoid any background noise. At the end of this webinar, there will be a 3-question anonymous survey, so your feedback is greatly appreciated if you wouldn't mind taking that. If you have any questions throughout the webinar today, please chat directly to the hosts and the panelists. We are going to save time as much as we can at the end of the presentation to see if we can answer some of the questions. And everyone who registered for this webinar, regardless of if you were able to actually attend or not, I will be sending out the link to the recording to actually all 3 presentations in just a few days. So if you happen to have missed the 2 other ones, which were responding to an opioid overdose with naloxone and also talking with your child about substance use, I will include those links as well. All right, so today's topic is the impact of cannabis, which is marijuana, vaping, and the youth's developing brain. So HealthNet was delighted to have partnered with the San Fernando Valley Partnership to bring you this informative webinar. And the mission of the partnership is to prevent and reduce the use and abuse of alcohol, tobacco, and drugs by mobilizing, educating, organizing, and empowering youth, parents, and other sectors of the community to address, through collaborative efforts, the root causes of community problems. So we are delighted to have Albert Melena with us today. He is the executive director. And then I just have one last slide here. Please keep in mind that the information provided in this presentation is intended solely for the general information of the audience. It is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. So that was my introduction. I'm going to stop sharing, Albert, and let you go ahead and share your screen.
Great. Good afternoon, everybody, and thank you so much for having me, and especially with this important topic. My name is Albert Melena. I'm the Executive Director of the San Fernando Valley Partnership. I've been in substance abuse prevention for about just over 30 years, and a lot of our work really looked at, identifying the role of access and availability on youth drug use. Specifically with cannabis, we really started looking at the increasing use of cannabis pre-Prop 64 here in California and post in terms of legalization. But, the other important consideration as we're talking about cannabis and the teen brain really is the impact now of these higher THC products. Another important piece is perceptions of harm. With legalization, a lot of young people really don't think that cannabis is dangerous, because it's legal. So we really are talking about literally high on risk and really how do we navigate the impact of cannabis on the teen brain. Definitely important to really understand that, adolescence is a particularly vulnerable time for young people because the brain undergoes extensive development. And what research is finding is that regular marijuana use during this period literally can alter the structure and function of the developing brain. Particularly the prefrontal cortex and the hippocampus, which are crucial for decision-making, impulse control, and memory formation. And I'll tell you, the other, I think for us, cause for concern is now the link between early use of cannabis and mental health issues. So we really have been following the evolution and the impact that it's having. And I'll tell you, it really is a challenge. So in terms of understanding the impact of early use, as parents, and well, we're going to share the presentation. There are some videos that I like to use oftentimes. Sometimes it's better to see like the news story or a particular piece that really underscores what we're talking about. For me, it always works well with young people or even parents in terms of what is it that we're seeing. How do we provide this information in a way that's digestible? Really helps us to understand. But what really looking at now is really how cannabis is impacting the teen brain, and we know that it directly influences their cognitive development. And I'm going to really focus on mental health only because of what we're seeing, increasing incidents. I'll give you an example. We had done a training for school nurses, about 200 school nurses. And what stood out to me was that, they were, Albert, you can't be serious in trying to tell us that what we're seeing is cannabis. And these were nurses talking about cannabis-induced psychosis or kids coming in experiencing extreme panic attacks. So, it's important and all of this to really contextualize this conversation moving forward is today's cannabis is not the cannabis that many of us grew up with. It's not the cannabis of the 70s, 80s, 90s. The cannabis is getting much more potent. The types of products now are much different than what we grew up with. And I'll tell you, following that evolution has really been scary. And in terms of just as parents, really being aware of the effects or recognizing the warning signs is going to be critical. But the other side of this is how do we have informed conversations with our teens, with our young people, in terms of really being able to provide factual information, appropriate guidance, and ultimately prevent the long-term consequences. And it's interesting, and I'll tell you, in prevention, when we think of prevention, we often think of education, making sure that we're providing teens with good information to make decisions. But it's interesting because it literally is difficult. Teens don't really think in terms of the long-term impacts. They're in the now. And the other piece here in terms of now social media, in terms of even their how they watch television. Many kids don't watch television. They watch these short clips, YouTube. So in terms of what is the messaging that they're receiving, their attention span, and all of these factors really do come into play. But the other important piece that we really do need to consider is that just perception of risk when it comes to cannabis. Only 35% of 12 to 17-year-olds perceive a great risk of harm from smoking marijuana once or twice a week. And this is the National Survey on Drug Use and Health. So, what is shaping their perceptions? And it really is important. The other important piece to really understand that, the adolescent brain is particularly vulnerable because it's undergoing extensive development. So again, if they start using early, and again, the other piece here that I'll highlight is this cannabis, especially what's popular with young people, is extremely high in THC content. So as much as we're concerned with its impact on the developing teen brain, these more potent products make it even more dangerous in terms of the impact that it's having on the developing brain regions. And again, focusing on the prefrontal cortex and the hippocampus, which are critical for decision making, impulse control, and memory formation. And the other important piece that we need to remember is just as teens and young people can learn much faster, they can also become addicted much faster. So definitely an important piece to think about for us as parents. This just came out today, which definitely is going to impact our young people. This is in the Journal of Addiction. It was either today or yesterday. Uh, Daily marijuana use is outpacing drinking in the U.S. now. So for the first time now, the number of Americans who use cannabis or marijuana just about every day has surpassed the number of those who drink. So it really is concerning in terms of what we're seeing. And again, now with the mainstream marijuana use, again, this is all contributing to young people's attitudes and perceptions around cannabis use. So it really is important in terms of what the research is showing us, though, in terms of high frequency use does increase the risk of developing cannabis associated psychosis. And, that's an interesting consideration because when most people think about cannabis, you think, well, kids are just going to get kind of drowsy, goofy. Not even close to what we're seeing now with today's cannabis. So these are definitely important considerations. We're going to share the presentation with you all. I'll also make sure I can include some other resources. There's a great talk kit and talking to your kids about the risks of cannabis. But I'll tell you, when you look at the types of products that are really attracting young people, and we're trying to talk about how dangerous it is, they're going to look at us like we're crazy. And again, when you look at the messaging that they're seeing outside of our home, it really is important. So another piece that I will touch on is going to be the role of access and availability and how kids are accessing a lot of these products. You'd be surprised, and we'll touch on that. I really like this video. I always like to share videos. This was a video when Canada was in the beginning on the front end of cannabis legalization in terms of really understanding cannabis and CBD. So there's been a lot, and then now I'm not sure how many of you folks have heard about Delta 8, an emerging cannabinoid that's spreading like wildfire. The other side of it, up until a few months ago, was largely unregulated, but we're still seeing this stuff at smoke shops close to schools. The Aspire Center conducted a study here in LA and found that 73% of the schools here in the city of LA were within 1,000 feet of a smoke shop. And what we found at these locations was mind blowing. The Delta 8 and these other emerging cannabinoids gummies. They're also even selling nitrous oxide. They're selling kratom. So definitely important to be aware of our community, what's close to our schools, where young people are going. So just as important is the role that access and availability plays. So definitely encourage you all to really take a look at your community environment, particularly schools.
Today's marijuana is not Woodstock weed.
I got to get my props. Cops come and try to snatch my crops. These pigs.
It's not even Cypress Hill weed. That was in the 90s, in case you were wondering. Decades of plant breeding for high THC content mean that some strains are more than 5 times stronger than in the 1970s. To understand why that's important, let's look at what weed does to your brain.
This is drugs. This is your brain on drugs.
But instead of frying pans, let's use neuroscience. Simply put, cannabis contains cannabinoids, about 85 of them. Many users may have heard of the big one, THC, or delta-9 tetrahydrocannabinol. It's the compound that produces the high, and it does that by binding to receptors in your brain and interfering with how your brain's nerve cells work. Users feel buzzed because there are high concentrations of these receptors in the areas of the brain responsible for memory, coordination, movement, and pleasure. The result? Suddenly the world seems a little different. Reaction time is slower, judgment is impaired, and while some find this experience pleasurable, others have reported severe effects like increased heart rate, anxiety, and paranoia. And some studies say exposure to THC as a teen may even increase your risk of developing schizophrenia. That brings us to pot's lesser-known cannabinoid, cannabidiol, or CBD. It doesn't have the same street cred as THC, likely because it doesn't get you stoned. Some research suggests CBD helps tone down THC's extreme effects, like anxiety and paranoia, by minimizing its effect on certain receptors. Researchers are even looking into using CBD as a possible treatment for schizophrenia. We tested 12 popular strains from dispensaries in Toronto and found weed that had no CBD at all. That's because when you crossbreed weed to increase THC, the levels of CBD can drop. Is it worth freaking out about? Well, maybe. THC potent strains can hit inexperienced users pretty hard. In Colorado, weed-related hospitalizations quadrupled after the state greenlit retail pot sales.
So what really is important to kind of understand how dynamic this issue really is, and now thinking about this within the context of our young people really is important. And again, as he talked about inexperienced users, we're really seeing that, especially on our school campuses. And I'll touch I'll touch on that a little bit just to really understand that piece. But I'll tell you, it really is important to understand that the impact of today's cannabis is much more profound. And I think that's always a starting point for some of us older adults who may think, well, it's not that big of a deal. I'd rather have my kid drinking, smoking cannabis than drinking. But I'll tell you, the research is catching up, and we're really seeing some major consequences and impact, especially with our young people. And this is a great a slide here in terms of, cannabis really is much more potent, looking at the other cannabis products as well. So when you think about this, so when you look at the increasing THC potency, what's important to also recognize is the product lines available. So people aren't smoking the joints as we would think, or the buds in the pipes. A lot of what kids are using now, what's easily accessible to them, are the cannabis concentrates or the products that are made from these concentrates in terms of the edibles. Definitely seeing a lot of that on school campuses, the vape products. And it definitely, again, is important to understand. So as we're talking about the developing teen brain, also understanding that young people really don't understand the risk. So as much as we assume that they can understand, or we're trying to convey this information, that we really are having to develop creative ways to really communicate the risks with some of these products to young people. But I'll tell you, it's important to understand that the products that they're getting their hands on, most of them have THC levels that are up to 90%. And that really is a cause for concern. You look at the products like the dabs in terms of how they're consuming these products. But I'll tell you what's interesting is the role now that edibles, and it's been interesting with edible products. You went from, brownies that were made with the dry leaves to now these edible products that are made from these concentrates, extremely potent. So I do really want to touch on that as well in terms of these concentrates. The solvent-based products, definitely a cause for concern. But when you look at a lot of these products, a lot of the liquids are the base for a lot of the edibles. But when you look at the shatter, the butane honey oil, the CO2, those are all different ways of extracting the THC. But I'll tell you, we're concerned with some of these products. The distillates that they're putting in some of these pens are odorless, tasteless, and it isn't even a vapor, a smoke. It's just a vapor that dissipates quickly. And you'll see how these products are marketed to young people. So as much as we're concerned about the impact that it's having, we also need to recognize the products that are really enticing our young people, the marketing that exists. So all of that plays a role in really shaping their decisions, stimulating their curiosity. So that's also an important piece. Just to give you an example, and we use Colorado, especially because they're further downstream in terms of legalization. But another important piece, as we've talked about, as far as cannabis's impact on the teen brain, really has been mental health. This was a report from Colorado in terms of adolescent emergency and urgent care visits. This was in the Journal of Adolescent Health in August of 2018. So this is how profound or how impactful this really is. Annual marijuana emergency room visits jumped from 161 in 2005 to 777 in 2015. And I'll tell you what's interesting here is that data from 2015 really just reflects 1 year of legalized recreational use. And these emergency room visits were really for behavioral health evaluation. So that was the main reason they were visiting the emergency room for initially it was the belief was it was a mental health emergency. So it's interesting that within these emergencies, as you look at that, so that the number of folks that required a psychiatric evaluation also jumped from 84 to about 500. So that's an important piece. In terms of the behavioral health evaluations in patients with either said they had admitted to using cannabis or tested positive in a drug screening increase. So that goes to show the impact that these higher THC products are having, literally sending our kids to the hospital. So that's an important piece. So that's the immediate. The other side of this is the long-term mental health effects that it can have. So definitely a good entry point for the conversation. The other side of it, and I touched on it at the beginning. The National Institute on Drug Abuse reports that the less harmful teens perceive a drug to be, the more use of that drug increases. And since cannabis is legal, most teens believe that it really can't be harmful. Another piece, though, now is the marketing, the products that are really contributing to this issue. What you have here, and I'm going to touch on that in this presentation only because we're just seeing so much of this stuff flooding our communities, are the Delta 8 products. So Delta 8 is a hemp-derived cannabinoid that, when eaten, is the exact same effect as Delta 9. So that's where it's also dangerous. A lot of kids think, oh, it's considered light weed when it's vaped or smoked. The effects aren't as intense, but when it's eaten, it's converted to 11-hydroxy. So the effects are exactly like as if it was the Delta 9. But we're seeing a flood of these products in our communities here in the LA area. We've seen a lot of emergency room admissions, so we'll touch on that, and we'll share a few news stories that you can see. But the other side of this, and I wanted to make sure I touch on this, when we're out in the community talking to parents, talking to other groups, the question is, what are our schools doing to keep our kids safe? And I'll tell you, the response to that is, it technically isn't a school issue. Our schools are having to deal with the flood of these products in our communities. They're having to deal with the consequences of easy access over the internet, social media, or these locations, smoke shops that are selling to kids. So the other side of it is, what are we as a community doing to ensure that our kids aren't accessing these products in our neighborhoods, or accessing them online or on social media? So that, even in and of itself, is definitely a whole topic for another training. But again, the flood of these products, and as we're looking at the developing teen brains, kids really don't perceive the risk. We're technically it's no big deal. Why I always get, Albert, you shouldn't worry about it. When I first got sick, I had to battle a few major health issues, and one of them caused weight loss. And I remember kids saying, "Oh no, Albert, you should try cannabis. It cures cancer and it cures this and all that." So a lot of this is the influence that this messaging is having on them. So the other side of it, as parents and as community members, we need to be ready to provide factual information. What we've learned over the years is that scare tactics don't work. And now, with kids having more access to a lot of these internet sites, they're actually doing their own research. But I'll tell you, it's important that we are able to engage in conversations with them and provide factual information. We've seen that works. And again, and when we're talking about the other side of this, as parents, as school administrators, is this is the other side of it. So in terms of our concern with cannabis impact on the developing teen brain, these early or these mental health emergencies, this is what's driving that, the ease of access. We've talked to us, this was one school administrator, this was 1 month of confiscated products. So this is part of it. And within that, you also get the resulting effects that it's having, the visits to the nurses, because they're having panic attacks, they're having trouble breathing, or are in full drug-induced psychosis. So definitely important that we really do understand and recognize a lot of the products that are available to our young people. And again, I just really wanted to contextualize the scope and the magnitude of the problem. This was a survey that was conducted by the LA County Department of Public Health, Substance Abuse Prevention and Control. And the question was, have you ever gone to work or school under the influence of marijuana? This was just over 10,000 surveys of adults, young people and adults. So you'll see the different age groups here. But when you look at the highest number, 12 to 17-year-olds, 61% reported going to school or work under the influence of marijuana. So we're really assuming because of the age, more likely it was going to school under the influence. So what was interesting, even more interesting, when we asked, well, what were the reasons for use? The top three were recreational, for fun, to relax, to get high. The fourth was to deal with anxiety and stress. What's interesting, so in this, the new one just came out. So to deal with stress and anxiety has moved into the top three, but it's also important to recognize with this much more potent cannabis and the types of products, it's actually contributing to stress and anxiety. So that's another important piece that young people may not understand. So that's the other piece. So just to give you one example, in terms of these high potency marijuana products, dabbing is also very popular, but that actually increases the risk of acute psychosis or other mental health issues. So oftentimes, as much as they may be using it to deal with stress and anxiety, can you imagine the effect now of these much more potent products that is actually contributing to that anxiety? It's making them more anxious, paranoid. So it really is important to understand and have these conversations. Again, what is shaping attitudes and beliefs? So again, this is where we start to see that connection in terms of what is shaping their attitudes and beliefs and what's providing access. So this is a smoke shop that was literally directly across the street from a high school. It's the back to school special. At the bottom of it, it shows a backpack. So I doubt that this was targeting adults. And what's interesting about this particular location, in our area, we're in the San Fernando Valley. This particular company literally has a smoke shop next to every middle and high school in the San Fernando Valley. We've seen it spread to other areas, but this is the kind of videos that kids are posting. And again, they're just having a good time. You look at some of the content, but again, this is what our kids are watching. This is what's shaping their attitudes, their beliefs, minimizing their perception of risk. They're in the school bathroom.
Oh, shit. He's gonna die.
So, I mean, this is what's right on social media. This is what they're watching. This is what they're seeing. The other side of it, again, is also now this hitting a blinker. This is a similar smoke shop, but when you look at the theme in a lot of these flyers, the back to school sale, the sale on the vaping product. So what's interesting now, we're also seeing a shift in the types of products. But what does this have to do with the developing teen brain? It's what messaging they're receiving. It's what's shaping their attitudes and beliefs. So that's kind of on the upstream, as we say, prevention, as we look at the impact of use, but also what is shaping their attitudes and beliefs. And this video here is interesting. So if you're interested on some of these social media sites, type in hitting a blinker challenge. So technically it's using your electronic device to the point that it's blinking. So blinking can be one of two things. One, that it's overheating, or what it's called session mode, where they pass it around. But this is the hitting a blinker challenge in school. But you'll see the last young man in terms of how it's also shaping use.
Blinkers only on the posters. Yeah, this was some big dog on that I have. Skywalker OG dog.
What the? What is the?
So it's an interesting conversation here. The other side of it is when you think about the teen brain, and really, again, the prefrontal cortex, the CEO, hasn't fully developed. So kids really are operating really through the limbic system, really looking at risk, reward. So when they see these kinds of videos, the reaction that they're getting from their friends, it really is interesting. And it's something that we really need to further explore. What is shaping attitudes, beliefs, what is really stimulating their curiosity. So these are important considerations also as we're talking about the impact of cannabis, but also cannabis marketing, the cannabis product lines, and how that's shaping youth consumption. So it definitely is an important consideration. And again, as parents, as community members, recognizing these products, looking at what type of messaging our young people are seeing is critical. Um, we're starting to see now a shift in products in terms of moving now, not so much away from vaping, but now edibles. Edibles are skyrocketing, so much so that the Wall Street Journal published an article on talking to teens about cannabis gummies. And again, the impact on the teen brain specifically relates to these products having high levels of THC. A good example can be under the provision of Prop 64 for recreational use. Cannabis edibles cannot have more than 10 milligrams per serving and a maximum of 100 milligrams per package. We're seeing gummies that have 3 times the recommended dose. Also, packaging shouldn't appeal to young people, and you'll see a few of the packaging here. You can tell it's directly targeting young people. The other side, again, for us as parents and really communicating the risks, people think, well, how could kids be eating a lot of this stuff? Why won't they, why isn't it dangerous? One, it's candy. Two, everything is gummy now. Vitamins, Tylenol. I've seen Tylenol gummies now. So it's interesting to see how the not just the cannabis industry, but the popularity of a lot of these edible products. So it's definitely important to understand the world that our young people, what's shaping or what's influencing their decision making. So that's an important piece here as well. And this is what happens. This is a result. This is 3 clips in terms of what we're seeing. And I'll tell you, this one is an important conversation to have with our schools or other stakeholders who are concerned.
We have more breaking news right now. 8 teens rushed to the hospital after becoming ill during a field trip to the La Brea tar pits. LA City Fire now saying the teens ingested marijuana edibles. All are said to be in fair condition.
A medical emergency at Van Nuys Middle School sent panicked parents to the scene after several students were rushed to the hospital.
We begin tonight, though, with breaking news. 8 school-age students in Sun Valley are recovering tonight after eating chewable marijuana gummies. It happened at Sun Valley Magnet School. 5 students were taken to the hospital. You see Skyfax capturing those ambulances below.
Well, what's interesting about all of these cases, the La Brea tar pits, I think it was about a week and a half ago that happened. And the question is, how can that many kids end up having to go to the hospital? And that one's simple. That could be simply one pack of edibles. It could be one pack of gummies or other candies, where a lot of these products are 2 to 3 times the recommended dose for an adult. So the other side of all of this is, again, the products that are enticing our young people or simply minimizing their perception of risk. So when you think about that, man, one gummy can't be dangerous. And the other side, though, too, and we'll talk a little bit about this, the risks associated with simply consuming cannabis in gummies is definitely important. But as we're talking here, a major concern specifically with cannabis's impact on the developing teen brain is the cannabis use disorders. We know, or the research is clear, that young people, adolescents, are more vulnerable to addiction. And once they begin using compulsively, cannabis interferes with their memory, with their learning. So that's an important piece in terms of how we communicate that risk to our young people. What's interesting here, this is one study, 50% of people of all ages who used cannabis in the past 30 days met the diagnosis for a cannabis use disorder. So it really is important, thinking about that. And the rates specifically amongst youth ages 12 to 20 were significantly higher. So when you think about that, our young people are at risk. They're vulnerable. And the fact that these products are flooding our communities should be cause for concern. So when we think of the impact of cannabis on the developing teen brain, it really is important when we really break it down. Cannabis's impact on memory, learning, mental health, and cannabis use disorders, so that it is important. I think a lot of that is we're finally getting to the point where that connection has been made. For a while it was a little blurry, folks. Well, that cannabis and cannabis use disorders really wasn't true. That it all goes back to the scare tactics. So it really is important that the research is catching up, that we can actually use science data to communicate the risks on the developing teen brain. This is Dr. Nora Volkov from the National Institute on Drug Abuse. So she touches on this, and this is why I like to use videos, because we can always go back if we're going to talk with a teen in terms of the potential risks. These are always great tools to help kind of make our point.
One of the main concerns that we have is, of course, that the younger they start, the greater the likelihood of addiction. But both for vaping and nicotine, or vaping and nicotine and vaping of marijuana, there is also the concern about the effects that these drugs may have on the developing brain. And the brain of adolescents is undergoing very fast transitioning. And part of the processes that regulate and mediate those changes as our brain develops are modulated by nicotine receptors, which are the ones stimulated by nicotine, but also by the cannabinoid receptors, which are the ones that are stimulated by marijuana, whether it is smoke or whether it is vape. And as a result of that, there is a big concern that through the use of these vaping devices, teenagers may be modifying their brain.
So that is an important piece in terms of how cannabis now is flooding the endocannabinoid system. And I have a piece there as well to really help us. But again, we now know, or now it's becoming a clear fact that the earlier the onset of cannabis use, the more likely teens are to develop a cannabis use disorder. So it really makes prevention critical in terms of making sure that we are doing everything we can to, one, educate young people about the risks associated with early cannabis use, but the other side is to address the ease of access, the availability of these products, and that's an important piece. This is a great short video. It definitely touches on the endocannabinoid system, again, that we can use to sit down and communicate with the teen or an adult who may really want to, again, with cannabis in young people, it really is important that it be a conversation, that we provide factual information. As much as we hope they understand that it really is going to impact you negatively, the more we can kind of get there through science, through data, what we're seeing, and making it a conversation is definitely going to be more effective.
Wondering what the brain's endocannabinoid system is and how it interacts with cannabis? Let's look at cannabinoids and the endocannabinoid system. Cannabinoids are compounds found in the cannabis plant. Two of these, tetrahydrocannabinol, THC, and cannabidiol, CBD, are psychoactive components of cannabis, meaning they alter the way the nervous system functions. THC is responsible for the high feeling some people get, while CBD is not intoxicating in this way. So how do cannabinoids interact with the brain? That's where the endocannabinoid system comes into play. This is a system in the human brain that helps regulate mood, memory, and stress. The main signaling molecules in the system are known as endocannabinoids, which bind to cannabinoid receptors called CB1 and 2. The two major molecules are anandamide, AEA, and 2-arachidonylglycerol, 2-AG. So what happens when cannabis is introduced to the body? First, cannabis can produce a range of sensations. For those who feel pleasure or feel good, this is due to the effects of cannabis on a region of the brain known as the nucleus accumbens. When THC binds to CB1 receptors, it leads to the release of a neurotransmitter called dopamine onto the nucleus accumbens. While the same thing happens when anandamide binds to CB1, the effects of THC are well above normal. This is what leads to the sensation of euphoria. CB1 receptors are also found in the basal ganglia and cerebellum, regions of the brain that are involved in controlling movement. So this can slow you down and affect your activity level and motor control. Some people also experience a change in perception, such as visual distortions or an altered sense of reality. There are many reasons we might use cannabis, and the way we use may change over time. We might use to feel better, connect with others, or reduce feelings of worry or anxiety. It's thought that when someone uses cannabis products frequently, the body and brain will reduce their own production of endocannabinoids. This means heavy and frequent use of cannabis can change our nervous system, and over time we feel more anxious or depressed. Cannabis use can also increase the risk of psychosis. The elevation in dopamine firing that comes with heavy cannabis use is implicated in psychosis. To recap, the endocannabinoid system functions using endocannabinoid messengers. The cannabinoids can influence the system. These messengers control many aspects of brain function, including euphoria, movement, and perception.
So it really is important to understand that there is scientific evidence in terms of really using these resources and tools to talk to our teens, young adults, and I'll tell you, once we're providing this factual information, I think it makes that conversation much easier. And in terms of people who do use, we've had conversations, and my question really is: have you had a negative experience? Ever experienced a panic attack or contributed to has it use contributed to like paranoia, anxiety, and you'd be surprised, when you're really having these conversations, they recognize that. So it really does open that door for a longer conversation in terms of the long-term risks, specifically related to mental health and a cannabis use disorder. But when we start to see the increased risk of mental health, marijuana, cannabis has been linked to a range of mental health problems in teens, specifically depression, anxiety, psychosis has also been seen in teens at higher risk. Definitely important that teens understand that whole piece in terms of a family history of mental health issues, and and again, that's not something they really would tend to ask. Hey, mom, do we have a history of mental health in our family? But I'll tell you, it really is important that we facilitate those conversations where teens really do understand that there are risks associated with early cannabis use, specifically the impact on their brain as it relates to cannabis use disorder or mental health issues, and definitely seeing a lot more. And I'll tell you, there's been some schools that have reached out. Same thing. There was a school where a student had eaten edibles too many and was gonna jump off a roof of a 3-story building, and it just turned into an emergency. Now it's rare, but the question is, how can cannabis result in that? And I'll tell you, as much as people still don't believe it or understanding, we're fortunate now that science, that the research is making those connections to help us communicate the risks to young people or family members that are consuming. This is a new story that came out making the direct connection, a study between cannabis use and mental health. So it really is a direct connection. So we can, I always like the videos because again, they help make our points here.
In today's Mental Health Monday, a new study shows a link between cannabis use and mental illness. Licensed therapist Dr. Cheryl Ziegler joins us in studio this morning with more on this study. Very interesting. So talk a little bit about cannabis use disorder, which the study talked about.
Yes. So I think a lot of people don't realize, but this is an actual diagnosis that we use in the DSM-5, which is what we use to diagnose people. So what that means is that someone's cannabis use is excessive. It is getting in the way of their functioning in work, in their personal life. If they stop, they feel withdrawal symptoms, and they also experience cravings. So those are some of the higher level criteria to meet for cannabis use disorder. And what was really interesting about this study that came out is that it said, if you had that disorder, that was your diagnosis first. They tracked 6.5 million people. It was a long longitudinal study. And what they found was those people were more likely to experience schizophrenia, depression, anxiety, and bipolar disorder. So they didn't come in saying, I feel depressed or anxious and I have a cannabis use disorder. That came first, this followed. This is really significant.
Now, this wasn't the first time we've seen a connection made between cannabis and mental health. What was different about this study that stood out to you?
So there were a couple things. The fact that it was a near 30-year study. It was done on all the citizens of Denmark, ages 16 and up. And they were really able to track them, and they were able to get out all of the confounding factors. Because when you do research, there's always like, well, but what about this? And so what they found was, yes, this is a multi-complicated situation because there are genetics, there are environmental situations, there are stress, there's class. So it's not nothing really with mental health is this equals this directly. It's this with genetic predisposition, high levels of stress can equal this or can result in this. So that was, I think, some of the things that really stood out. This is really important for people to understand.
What can we take away from this study?
So I think one of the things, particularly here in Colorado, is that you really can have a cannabis use disorder. You can be addicted. And there's always this controversy, but this is something we've been studying for a very long time. And so you can be addicted. You can reach toxic levels of THC within your system. And this link with, I'm going to make it really simple, with psychosis and with just exacerbating pre-existing mental health conditions. So if you do already have depression, anxiety, a history of bipolar disorder, and you use cannabis excessively, I'll emphasize excessively, we don't know the safe limit. So whatever excessively means subjectively to each person, we can see this connection with psychosis and really poor mental health outcomes in the long term. And I really want people to understand that.
Okay, so there's a new report from the CDC, and maybe at home you've seen this, that shows more teenagers went to the ER for marijuana use during the pandemic. I want to know what your take on that is.
Well, we saw this happen when marijuana was legalized recreationally here in Colorado about 10 years ago. So we saw the spike. And so that makes sense to me. It was the pandemic. And with edibles, particularly edibles around, there was sort of two camps. It was edibles that were around that children were ingesting. And one of the poor things about this outcome is that it was kids 11 and under, over 200% increase, right? So those were accidental.
Right.
And then there were also the older teenagers that actually it wasn't necessarily accidental. They were just overusing to the point where they felt physically sick, had mental symptoms to the point where they had to go to the ER. So once again, highlighting you can consume too much THC, which can be toxic to your physical and mental health.
Which is something that we're having to dispel now, because for a while it was saying there's no such thing as too much.
Right.
Yeah.
Or that it's not addictive.
It's
and
not
clearly
addictive.
that is not true as well. Dr. Ziegler, thanks for coming in.
So I'll tell you, as scary as it sounds, the importance of it, it just now provides more factual information for us to engage in meaningful conversations with young people. So when we start to see now the impact of cannabis use specifically on teens, the teen brain, the connection to mental health disorders and cannabis use disorders, the science is clear, and it's definitely something that can help us have informed conversations. I just wanted to touch on a little bit on these Delta 8 products. Again, widely sold at smoke shops. Kids are able to get them on social media platforms. So it definitely is something that we need to be more aware of. We're fortunate now that there's more regulation. You can actually submit complaints. So that's a whole other piece. And definitely, if you all email me, would like more information, definitely send some of those resources. And I'll tell you, especially if you're a school administrator, a counselor, a teacher, or simply a concerned parent concerned about the products that are available at these locations, we do have a means now to submit reports. But again, my concern with a lot of these edible products is a lot of kids are unknowingly consuming, or kids will give it to them, or the other side is really the time it takes to feel the effect, whether it's Delta 8 or Delta 9. So that's an important piece of information, because it can take anywhere from 1 hour to over an hour to feel the effects. Most kids accidentally, and even adults as well, accidentally overconsume. So you're already eating a gummy that may have 2 to 3 times the recommended dose for an adult, and now you're accidentally overconsuming. So it's important to understand that where smoke cannabis, you feel the effect pretty quickly. but when you're eating it and it takes that long, now when your body's processing it through the liver and it converts to 11-hydroxy, the effects are much more intense and much longer lasting. So that's definitely an important piece of information. These are the Delta 8 products. So we kind of really use that to talk about both, but Delta 8, as much as it's promoted as a light weed, when it's eaten, it's the same effect as Delta 9. So, and this stuff is, I mean, plentiful. And really within the edibles, we're seeing all kinds of products. So definitely something that we should be aware of. And as I mentioned, definitely encourage you, if you live in a community that has a lot of these smoke shops, or specifically smoke shops close to schools, you're going to be amazed by what these places are selling. And unfortunately, this is the stuff that's getting in the hands of young people. So in terms of really, implications for prevention, it's important, critical that and I think the other training did talk about that, on talking to teens about the dangers of substance abuse, but really providing factual information as community, as parents, is critical. But on the other side is folks who may play a role in prevention. And a lot of us do, whether we're a school administrator, a counselor, a concerned community member. Reducing access and availability is key. And a part of that is, again, looking at key settings where kids may be using and identifying maybe hotspots, and making it harder to use. But I'll tell you, definitely addressing the accessibility and availability, providing factual information. And the other side is important, that we really do address these other contributing factors. It's important that we make it okay to talk about mental health, that create safe spaces where we can, and teens can talk about stress, anxiety, and help them develop healthy coping mechanisms. That's definitely an important piece. But I'll tell you, there's a lot of information here. I was trying to really present this in a way that was more digestible, something that's practical that we could use. But just in closing, I just really wanted to share a lot of the research definitely makes that connection between access, availability, and use. So it really is a major issue, and something that we can definitely do something about. And this is just a quick news story. We're right there. I'll leave enough time for some questions, but this is just so you can kind of see this.
Until COVID-19, it was one of the biggest health problems facing schools across Southern California, teen vaping. Now, our I-team has discovered that the danger is back in focus with students back in class.
But if you think your kids are not susceptible, investigative reporter Lolita Lopez shows us just how easy it is to fool you.
Can you please take this pen and write your name?
Okay. Lolita.
It's good. It's a nice pen, yes. Right? Well, you can also use it to vape.
Vapes disguised as everyday devices. This to me looks like either an old iPod, if you're that old, or, I don't know, remote control to something.
This is a battery for a vape.
Drug prevention advocate Albert Molina says these newer devices can easily be hidden, even in plain sight. This, which I would think was just a regular key fob to a car.
Unfortunately, it is also another vaping device.
Molina says he's in regular contact with principals and teachers who are catching a growing number of teenagers with these types of devices. The I-team found similar products for sale at smoke shops throughout Los Angeles.
There are more smoke shops in the city of Los Angeles than there are McDonald's or Starbucks.
In fact, there are more than 3,400 locations currently licensed to sell tobacco products, including smoke shops, grocery stores, or the corner shop down the block. And they're often near schools. Take a look at this map of Los Angeles, specifically all those red dots. That's every school within 1,000 feet of a tobacco retailer.
So definitely important to really understand what is contributing. So aside from teens, part of it is self-medicating. Again, a lot of this bad information that they're receiving, really understanding the role that access and availability is playing. I have my email address here. If anybody would like any additional information or has any questions that maybe we can't get to, I'm always happy to respond or share any information. Lord, do we have any questions, comments?
Yes, there's a question here that says, forgive my ignorance, is the higher the delta range reflect stronger ingredients?
In terms of, well, the THC, what's happening now in terms of these cannabis products, different growing, methods, and now combining the strains is really creating a more potent cannabis. Now, the other side of that is the extraction methods now are becoming more sophisticated. So the growing methods, the plant now breeding, all of that is really designed to increase THC content. So you're also seeing that again with the process now in creating these Delta 8 products. And the goal, unfortunately, is stronger and stronger and stronger. We've visited even dispensaries in terms of just kind of getting a sense of what products are more popular. And their comment is always, hey, people want stronger and stronger. Unfortunately, the impact of that potency really is impacting our young people negatively, as you've seen in how it's affecting their developing brain, its connection to cannabis use disorders, and mental health. So, yeah, no, that's a great question. A lot of it now is just the way the industry is evolving and the push for stronger and stronger cannabis.
Another question, Albert. Let's see, it just rolled to the top here. If we would like to refer a student to the San Fernando Valley Partnership, what are the requirements, such as Medi-Cal, clients, or any age limit?
Oh, yeah. We're not a treatment organization, but we can definitely always help you find a place that's close to you. I definitely share the resources. The LA County Department of Public Health does have a link where you can find treatment services. But more than anything, yes, if you'd like to, definitely help you connect with the services.
All right, an additional question is, are the effects the same on adults? So I'm assuming Alicia is talking about the edibles, but regardless, could you tell us
Sure.
what that
Well,
might be for all products?
Sure. In terms of the immediate, especially like with over consuming, definitely across the board. But the concern with the developing teen brain, it is because it's developing it much quicker. So I think that's the other piece because it's undergoing extensive development. So that's where the concern is for young people in terms of how it's going to impact the developing teen brain in the long term. But in terms of the immediate effects, most definitely. Again, the other side of it is teens may be, in terms of weight and things like that. But as far as overconsumption, we're seeing emergencies for adults as well. So we definitely interviewed adults who had extremely bad experiences with cannabis edibles or again, cannabis-induced psychosis. So, I mean, it can definitely impact adults as well. We're concerned though with the long-term impact that it's going to have on young people, and specifically because their brain is developing so quickly at a critical point. But that's a great question.
And then Cindy asked a question about, is there a map that shows both cannabis and tobacco retailers, the density in California, so where they may be located?
Yeah, you can. I know the Aspire Center has a report, and depending on what city you're in, they may have a tobacco retail license. So looking at your local, even I know for LA, you can reach out to Tobacco Control, the LA County Department of Public Health Tobacco Control, or in the city of LA, the city attorney's office has the tobacco enforcement unit. But I'll tell you, it definitely is important. The other interesting tool that you could technically use as well is Google Maps. Look at your school and type in smoke shops and you'll see. I mean, it was interesting. We had published a paper with a university and we got a call from a state back east. And the question was, hey, I just have a question for you. We have a vaping curriculum. Our state hasn't legalized cannabis, but everybody the students we're catching are all vaping cannabis. Where do you think it's coming from? So I asked, do you have smoke shops? And what are you talking about? Like tobacco shops. And he's like, oh, I didn't even think about that. So we Googled it as we were talking and it lit up like a Christmas tree. So unfortunately, some of these locations are also selling illicit cannabis. So because it's not coming from a licensed dispensary, it's illicit. Now, the other risk associated with that illicit cannabis product is chances are that product failed state testing, which means it's going to have high levels of mold, pesticides, and even banned ban pesticides, mold, fungus, and heavy metals. So it's definitely a concern on a number of levels.
Okay, great. Thank you so much, Albert, for your time today. We're just a couple minutes over. And Maria, I'm
sorry.
going to add your question directly to Albert, so I'll be able to answer that when I send out the recording. So again, thank you everybody for joining us today. Albert, thank you so much for your time. Excellent, excellent presentation. Really great feedback in the chat. Again, I'll be sending out the resources that Albert had talked about, along with the recording link and the slide deck as well. So feel free, everybody, to exit the webinar. Thank you so much for your time today.